Hi, this is Johannes Huitink. I'm an anesthesiologist based in the Netherlands and also the founder of the Airway Management Academy. Today I will show you some tips and tricks about video laryngoscopy. I will show you how we use the video laryngoscope for tube placement. This is a tube with electrodes on it, and we use this special tube during thyroid surgery. The surgeon can see during surgery if the vocal cords are still working and if there's no damage to the current laryngeal nerve. This can be placed with normal direct laryngoscopy, as we have done for years. So I've got a Macintosh blade, the direct laryngoscope, and I will show you how it is done. I'll put in the laryngoscope. I'll try to obtain the best view, and now I have a comical line grade 2. And as you can see, placement of the NIM tube may be a bit awkward or difficult, and nobody can see what is going on in the larynx. If I exchange my laryngoscope for a video laryngoscope, thank you, I can use it and make this intubation a wee intubation. Everybody in the room and my assistant and even the surgeon can see if intubation is done correctly. So I'll take the video laryngoscope, introduce it, and I'll get a nice view of the glottis. I would say this is a percentage of glottic opening of 80%. And I can place the tube. Everybody can see what I'm doing. And we can perfectly see that the electrodes are placed correctly between the vocal cords. And this is very important. So this will be a happy surgeon, a happy patient, and a happy me, because we need to do 3 or 4 patients in a day. And this is smoothly, correctly, and there's no issue at all with intubation. So when I place my tube, I would use a video laryngoscope. This is how it is done. Thank you very much.